Welcome to another episode of Wild and Well. Today I'm talking to nurse practitioner turned entrepreneur. She's a heart mom, a mental health advocate, Sarah Michelle Bose, all about becoming a successful entrepreneur, navigating the challenges of having a child with congenital heart defects and what it looks like to do advocacy work. And I'm sure we're going to get to so much more other than all those, but welcome, Sarah. Thank you for coming on the show. And before we get into all of that, can you tell us one thing that you've done today to take care of you?
One thing today that I've already done to take care of me is I actually meet up with a really good friend once a week and we go to a coffee shop together. And sometimes I write on my newsletter, sometimes I write on my memoir. And so this morning I met up with her and we wrote on our books together.
Oh, what a beautiful
It's really
weekly
cool.
practice.
Yeah, it's fun.
Yeah, those are life goals for me, getting together at a coffee shop to write with a friend. I love that. So you have had quite an interesting path. Like just in that introduction, I listed off a number of different things that are very
Lots
diverse.
of hats.
Yeah, lots of hats. Can you tell us a little bit about this path from studying to be a nurse practitioner until present day?
Yeah, I think really at the core of my story and kind of invisible string that I'm trying to string throughout my memoir right now as well is my mental health journey. When I was in nursing school, I actually ended up having a panic attack during one of my clinicals in front of my classmates and my instructor and all the nurses. And it was the first public panic attack I'd ever had, but it definitely was not my first panic attack by any means. And as a result of that experience, I was actually told that I was too anxious to become a nurse and that I should just leave my program altogether. But fortunately or unfortunately for me, I was paying for my own school and I really couldn't afford to drop out of the program unless I was forced to drop out of said program. And so we came up with this whole bizarre action plan and like almost like behavior plan to see if I can make it through the semester. And I did. And it was a really cool moment for me. And it was actually a pretty life-changing moment because one, it was the first time I had advocated for myself. Two, I was advocating for my mental health. And three, I would eventually go on to tutor that class and teach other people how to pass that class and realize that like, oh, hey, like I thought I loved teaching, but I really love teaching. And how cool would it be to like one day teach other nursing students who are just as anxious as me because they make nursing programs from the outside, you can't really see it, but when you're in it, it is such a pressure cooker of anxiety and high stakes, and you're always like, it's you never like get to a safe point in the program. Like they're always trying to weed you out because they want to make sure that the people that graduate that program are A, going to be safe nurses, but B, are going to pass that exam on the first try. So as I kind of made it through that experience, it wasn't 6 months after I graduated with my bachelor's in nursing, then it was going to go back and get a master's in nursing education. And then I ultimately went back after that to become a family nurse practitioner. And I joke with people all the time, but it's very genuine. I never really aspired to be a nurse practitioner. I just thought it would get me into teaching roles faster and kind of like expedite my career path because I actually graduated with my nurse practitioner degree when I was 25 years old. So I was just kind of like speeding right along, getting through as much school as I could. And then that ultimately led into me starting my nurse practitioner test prep business, which was kind of this wild, crazy whirlwind experience because I graduated nurse practitioner school during COVID. And the anxiety was higher than literally ever because you would show up to these testing centers and you never know if you were actually going to test. Like, I can't tell you how many times I showed up and there'd just be a sign on the door and they're like, closed today. And then you would have to figure out how to reschedule all this stuff. So there was so much anticipation and uncertainty. And long story short, at the time, none of the review courses out there, it was a very archaic market. We're talking about exam day anxiety as a part of the process. And so I created a little review course for my classmates that incorporated that in as a piece of it. And it was truly an overnight success. I mean, people just resonated so hard, so fast, especially with it being during COVID, that the first month I made 20 grand, which was almost half what I used to make as a nurse. And I was like, what is happening to me right now? And then within 7 months, I had hit $1 million. So my whole life changed what felt like overnight. And I feel like I've just been writing that ever since then.
Wow. And what do you think it was about what you'd created that made it so successful?
I think there were a few different things. Definitely the exam day anxiety angle, just because nobody else was doing that, and people hadn't really felt seen in that way before. I think when you're in these nursing programs, like you're told to stuff all that stuff down. And you don't want to bring that to the surface because you don't want to display that in front of patients and all these different things. But if you're getting master's and doctoral degrees, like you're typically a type A student, there's typically going to be some underlying anxiety there. I think the other thing was I created a community of people. And so all these people were talking to one another, like, what are you doing to prepare? What am I doing to prepare? Like, how can we kind of congregate together? And what I became was a trusted resource. And obviously, like as a brand new nurse practitioner, I don't know it all, but I do know enough how to look things up and be reputable and give answers. And people were just looking for a human who would kind of like hold their hand in the process and be like, hey, I've done this. I've got you. Let's do it together. And that just really hadn't been seen in that space before. A lot of the review courses were very much like, 2 10-hour lecture days in person at a conference center and you're done. And mine was very much like, watch it as much as you want. Let's come together. Let's do live classes together. Let's actually talk about the content. And so everything was just kind of totally different than what people had seen before.
Yeah, very interesting. And I think that you really touched on some things there that people want to be able to go at their own pace and then have that
Yes.
support, that in-person support with somebody who truly does understand.
Yeah. Somebody make them feel good about the process too.
Mm. So for listeners who are thinking, oh, I'd like to start a business, or maybe they have an idea, what do you recommend? Because yours just went like from zero to a million so fast. Like any advice for somebody who's in that real like beginner stage?
Actually, what I tell people, it sounds super simple, but I promise it's like one of the best advices I could give you, and that is just to start. I mean, I was sitting outside of a testing center. Me and a friend had tested together. It was our first time meeting in person, which was really fun because we were friends online through our program. But we decided to test together on the same day. And I was waiting outside to like really meet her for the first time. And I had the idea for my business because, I did every review course out there. I had all this anxiety, all this different stuff. And then when I went to actually take the exam, it was super easy. And it was like 175 questions. I finished it in less than an hour. I was like, I way over prepared. Like, if I can graduate nurse practitioner school, like I can pass this exam sort of thing. And then I had the idea right then and there, like, why don't I just make my own review based on like exam anxiety strategies and content strategies and just bring it all together. And I think where a lot of people get lost when they want to start a business is like they have the cool idea, but they let that just continue to be an idea. Versus I was like, okay, like I have this idea, I'm interested in this. And within 7 days, I created a 3-hour course. I had recorded it. I made PowerPoints. I created a Facebook group. I gave it to all my classmates for free. I said, invite somebody else in because I'm giving you this for free. Let's go. And that's very much like how I operate my life. I mean, it's a little intense, and I know it sounds intense, but if you really just like, if you have the idea and you just put it out there, it doesn't have to be this perfect polished product. Like it just has to be, I don't want to say the bare minimum because I think that negates what I built, but just get something out there because you're going to iterate regardless. And a lot of people are like, I need the LLC and I need the website and I need the business card and I need this. And I tell people I didn't file for an LLC till I made 150 grand. I didn't even know like that was something I needed to do. And then I'm like trying to catch up and pay taxes and all these things. All of that is figure outable. If you have a great idea, just do the idea.
Yeah, that's incredible. Like that is so inspiring. And you say maybe it is intense, but you are actually getting the things done that you aspire to do. You're having that
Yeah.
idea. And there's so many people, like you're saying, that have the idea, but they don't go anywhere with it.
Just gotta get some forward momentum of any
Yeah.
kind.
Yeah, amazing. So can you talk to us about your experience like with your child Meadow and what that was like to find out her diagnosis? Because that is like just a completely separate or secondary chapter to this, isn't it?
Yes. So, for a little bit of like zoomed out perspective, I started my business in May of 2020, tail end of May. I sold my business to a bigger test prep company in June of 2022, so like right at the 2 year mark. And when I sold, I was actually 8.5 months pregnant. And obviously the company that was acquiring mine was fully aware of that. And so like we were kind of like setting some plans in place, like I'm gonna have my quick maternity leave. I'm gonna come back because, something that my business kind of suffered from was key woman syndrome. Like my name, my face was a lot of the business. People expected me to be there. The students expected me to be teaching. Um, and I was kind of wearing 1,000 hats by that point of all the different things that I was touching and doing. And it's not to say that like having my daughter was going to be a blimp, but it was going to kind of be like a blimp in time for me to take this leave and then come back, integrate into the company, etc. Um, but what ended up happening was when I sold, we actually didn't know that Meadow was sick. And about 3 weeks after selling my business, it was just crazy, just like almost felt like a fate turn of events sort of thing where in my second trimester, I'd had an experience with my OB where I remember looking at my husband and being like, if something goes wrong in the delivery room, she is not the human I want there. Like, I don't trust her. I feel like I have rapport with her even after all these appointments I've had. Like, I just feel super uncomfortable about the whole process. And so in my third trimester, I switched OBs. And as a result, they did another anatomy scan just as a liability check. And then when they did that anatomy scan, I was probably 32 weeks. And they were like, well, something looks weird, but we don't know exactly what is weird. Just something looks off about her heart. And literally, the OB was like, it's probably a normal variant, but we'll send you to maternal fetal medicine just to know for sure. And at 34 weeks, we found out she definitely had a heart defect of some kind, but we didn't know exactly what it was because unfortunately by that point she was so big. Trying to get her in the right angle to see exactly what it was way more tricky than she had been at 20 weeks. And so at 36 weeks, we found out that she wasn't going to have one heart defect, she was going to have four. And her four heart defects are known together as tetralogy of Fallot. And she has one of the most severe types of tetralogy of Fallot because one of those defects is that your pulmonary valve, which is what supplies blood from your heart to your lungs, is tiny. But unfortunately for her, she was born without that valve altogether. And so that makes it a much more high risk case. And everything about my business, the joy of selling the business, thinking about integrating post acquisition, all of that stuff really kind of had to fly out the window for me because she was now going to have her first heart surgery in her first week of life. And then she was going to go on to have another major open heart surgery by the time she was a year old to even have like an opportunity at living. And everything about that experience was so jarring because it was the end of my pregnancy. We had just sold the business. We're supposed to be riding like the highest high of our life right now. I'm supposed to be back what feels like tomorrow to run this thing. And I really just don't have the capacity or the bandwidth to do any of that.
Wow. And what were you feeling at that time? Like, how did you process that
Um,
diagnosis?
Unfortunately for me, I did not know at the time that I have obsessive compulsive disorder. And I had had a lot of anxiety throughout my pregnancy of like, if I do X, Y, or Z, then something bad will happen to the baby. And one of those things for me was if I announce that I'm pregnant, then something bad will happen. Or if I have a baby shower, then something bad will happen. And what ended up happening was I had a wonderful friend who threw a surprise baby shower for me probably about 5 days before we found out that Meadow was sick. And so I just felt horrendous, and I do mean horrendous guilt. All I remember in those last few weeks before she was born was just how guilty I felt, and I felt like I had somehow caused it, which I'm a nurse practitioner. I have a logical medical brain somewhere up there. Like I know that her heart formed at like 5, 6 weeks. It wasn't something that happened in week 33. But when you have a disorder such as this, like you can't really logic with OCD when you're kind of like deep in the throes of it. And you kind of have to live in the uncertainty, and that's really hard. But that's especially hard when you don't know that's what you're dealing with. Um, and I felt like I can't even remember most of those last few weeks before she was born. Like I tapped out of my business. We had tons, and I do mean tons of doctor's appointments of checking on her, getting introduced to the cardiac surgeon, the cardiac ICU. We went through a whole like tour process. Like everything was just kind of lost for me.
Yeah, I imagine. And did you find like having that nursing background and having that knowledge that help you navigate the medical system as a parent or not so
It
much?
was actually incredible. It was incredible for me, the night that my daughter was born, for example. There basically, when you were born, there's a hole in your heart that's open for about 24 hours. And then it closes up, and that's supposed to happen. Everybody moves on with their life. But for Meadow, until she had that first surgery, she really needed that hole to stay open. And so they had to start a medication to keep that hole open because, she was missing that valve. So that was the only thing giving her the blood flow and oxygen that she needed. And I tell you all this because when they started the medication the night that she was born, one of the side effects of the medication is actually having apnea episodes. So she stopped breathing for a second because the dose was too high. So they were titrating and figuring all that out. And had I not been a nurse and not been a nurse practitioner, like I would have thought like my baby is dying in front of me. But instead to have even just a little bit of knowledge to be like, this is a medication side effect. Yes, did they just intubate her? Yes, I mean that sucks. But this is kind of like a band-aid until we can figure out this dosing, and then they're going to be able to take her off the ventilator, all these things. And so being able to rationalize that for myself, but then also explain and rationalize that for my husband, who has no medical background. The only people he's ever seen on a ventilator are people who have died. So I mean, like he literally thought she was dying in front of us. Um, and to be able to take a step back and be like, no, this is just a band-aid fix. It was really incredible throughout all of our hospital stay because we were there 4 or 5 weeks after she was born. And then we spent another couple of months around the holidays there when she had her major surgery. And to be able to just know what was happening, know what was going on the monitors, to be able to explain not only to my husband, but to our family and almost like act as a translator, it was a burden and a gift at the same time.
Yeah, I can imagine. And if are moms listening who are going to navigate a similar situation or have like, what advice would you give them?
Um, Two things. One, you are the expert in your child, even if you have no medical background. And so when we were looking at Meadow, me and my husband both, like, we can pick up on the little nuances, even at a month old, even at 4 months old, and be like, something feels off here, and be able to communicate that to her team. Even if her team, like, they walk in, like, oh, she looks fine. Like, yeah, but this is weird for her. And remembering that you have a place on that team. Also, tell people too, you have to educate yourself. I sometimes meet parents that can't tell me, like, the name of their children's heart defect. And I in no way judge them because I know there's just so many pieces and so many things going on. But I think you have to know, like, what is your child's defect? What does that mean anatomically for them? Because until you have both of those pieces of information, like, how can you try to make clear and good and educated decisions about their care? Because you're going to be involved in their care. And I think maybe the third thing I would add on it's just remembering that the medical team and you as a parent or you as a set of parents, you're all on the same team. Like you're never on opposing teams. And sometimes, it can be really tense, it can be really hard. People have differing opinions. But if you remember, like everybody's goal here is the same, and the goal is for Meadow to make it out of the hospital and be as healthy as she can be. I think that was a really good reset and a reframe for both of us.
Yeah, I think that's so important, isn't it? Because in those situations, there are so many heightened emotions and,
It is
like you say, opposing
super high
views.
stakes.
Yeah. And what do you wish that like friends and family would have known so they could support you during this time? Like if there's somebody listening and they have a friend or like a sister or brother or something going through something like this, like what would be helpful for them to understand?
I think it is really, really uncomfortable and really hard for other people to like sit in our discomfort or sit in our grief with us and not try to fix. So I would definitely say just like whoever it is that you're talking to, if it's a family member, a friend, whoever's going through a hard time, just like hear them out and let them have that moment. And you don't have to intervene and fix because there's a lot of times that you just can't fix whatever that situation is. Like Meadow almost died after her second surgery. Like nobody can fix that for us. But it would be really nice to not, because what happens is when the other person tries to fix, then like you feel uncomfortable and then I like try to fix it for them and I try to make them feel better about it. But I'm really like, I don't even have capacity to be doing that. And I think the other thing that's really, really, really hard for me, and I have to like take a breath every time someone says it because they mean so well, is, Meadow had most of her heart defects fixed. Fixed is a relative term in the heart world, but she had most of them fixed when she was a baby. But she's going to go on to have more open heart surgeries throughout her life because essentially she has a fake heart valve, and every time she grows bigger, then we have to replace that heart valve. Um, and we're very close to a world where we can start doing that with alternative procedures, which is why I do advocacy work. But for right now, every time she needs a valve, she has to have open heart surgery again. And when people see her and they don't know like all the details, what they'll say to me is like, "Oh, she's normal now, right?" And it's like so invalidating of our experience and what we've lived with her, but it's also invalidating of what our future looks like and all the uncertainty that we sit in all the time. And I love that she looks normal from the outside, but I just really, really, really hate that phrase.
Yeah. Yeah, that's so tricky because I think from the outside, people just see, oh, she's been through this. That was hard, but look where
Oh,
she is
yeah,
now. But that's not the actual experience, is it?
for sure.
Yeah. And you bring up a really good point that I think as a society, we aren't very good at sitting in like really hard emotions and and feeling that. So like friends sitting with you and feeling your grief, they just want to fix it, but that's layering
Hmm.
on more work for you if they can just be there
Absolutely.
and be with you and sit with you in that and feel that for you. It doesn't change things, but it at least gives you that safe space.
Yeah, and we actually, they had a pretty strict visitor policy about who could and couldn't come in, but we ultimately decided to have no visitors when we were in the hospital, like in her room and stuff, for that very reason. I was like, we're going through so much. We're going through too much right now. Like, I can't imagine trying to bring somebody else into this space with us and like all the things that they're gonna feel on top of it. Just like even seeing the display of the things going on in her hospital room.
Yeah. And how do you take care of yourself during this? Like, do you take care of yourself during this?
I would say between surgery one and surgery two. So surgery one was first week of life. Surgery two is emergently at 4 months old. We thought she was gonna be closer to a year, but we didn't make it that long. And that time span, everything was just survival. I was like, I just have to make it through because even when we went home from the hospital for a little bit in the in between, basically our home became an alternative hospital. Like she was always hooked up to monitors. We talked to her cardiologist literally every single day. We were in this very intense like monitoring program. Um, but after we got out, and Meadow was closer to 6 months old at that point. I mean, we weren't even out of the hospital a week when I got my OCD diagnosis. Because when we got home, they're like, kind of like, okay, she's good now. Like, take her off the monitors. Like, everything is kind of normal. Like, you can treat her like a normal kid. But when you've been in this intense hypervigilant state for months on end, that is so jarring and so uncomfortable. Like I just couldn't even do it. Like I would just still hook her up to the monitors. Like I would still want to call her cardiologist even if I didn't. Like I feel like I was just watching her all the time. And I got to a point I was like, I can't sleep, I can't eat. And um When I was pregnant, a friend had mentioned to me, a friend, business coach, mentor, she was kind of all in one, that she thought that I might have OCD. And so I was like, I don't know if I have this OCD thing, but let me just go get an assessment and see if I do, because if that would help me sleep or function as a normal person, or honestly, even just like be the mom that I want to be, because when you have a medically complex child, it would be so easy and it would be so understandable to be a helicopter parent, but that's not really the kind of mom that I wanted to be, and it wasn't the relationship I wanted to have. So I think my first big step in caring for myself was getting my OCD diagnosis. And then, we talked a little bit about intensity earlier, but when I did the OCD scale, it was out of 40 and I scored a 37. So obviously it was infiltrating most areas of my life. And I decided to actually do what they call an intensive outpatient program, where for about a month, maybe it was 5 weeks, I would do therapy every single day for 4 to 5 hours and just try to tackle this OCD thing head on and figure out how to work with it and how to manage my brain. And by the time I got through that process, I mean, I think I had jumped down to like a 13 out of 40, which is way more manageable. And then I could figure out what I wanted to do with that. But when I got the diagnosis, I was like almost like in a point of crisis.
Yeah, that sounds like the anxiety was very, very high at that point. And in a lot of ways, how could it not be, given like what you had just gone
Yeah,
through, and then to suddenly be like, okay, now treat your
you're
child
good.
normally. Yeah, like that's such a shift. And you see that when people are going through really stressful times, and then suddenly they're like I think about people say going to war, right? They're in this really stressful situation, and then they're suddenly at home where everything's like safe and okay. It's really hard to cope. It's like so I almost
Is that
like
how do you
see,
reintegrate?
yeah, like
What is
that
your
takes time.
normal? Like, there's so many layers.
Hmm. So what did you find was helpful from that intensive? Like what were some of the skills or strategies or even mindsets that helped you to like, tackle that and be able to live with those challenges?
Yeah, OCD at its core is an intolerance of uncertainty. So you want everything to be absolutely certain all the time. That's very unfortunate because nothing is certain ever. Even when you think something's 1,000% certain, it is technically not. And as a part of OCD, some of the compulsions that you can have are things like reassurance seeking, and that one's very sneaky. But as an example, like I might ask my husband, and this is silly, but I'll be like, "Do you love me?" And he'll be like, "Of course I love you." But then, like, the anxiety starts again, and then you ask again, and you ask again, and you ask again, and you get a little bit of relief when you get the answer, but it becomes this insatiable cycle. And so, knowing what the compulsions look like, knowing what my brain was doing, and then doing the therapy that was geared around it. The gold standard for OCD is literally exposure therapy. So I tell people you just face all of your worst fears head on and realize that you don't die. And then you get up the next day and you do it again, you do it again, and you do it again. And you kind of expose yourself so many times and desensitize yourself so many times to be like, okay, like I didn't do X, Y, and Z and nothing bad happened. Or I did do this thing and then nothing bad happened. You know, Unfortunately, sometimes OCD will get it right, but it's kind of like a fluke thing. Kind of like having a baby shower and then suddenly finding out your daughter is sick, like it was just a fluke thing. Um, but doing all of the things that I was most scared of doing and realizing that for the most part, nothing bad happened really kind of set me up for success of just living with more uncertainty in my day to day. Because really, at the core of all the things that I did in OCD therapy was figuring out how to live with uncertainty, but also giving myself more compassion too. I feel like as a result of doing the therapy and doing the work, I just have so much more compassion for myself and my experience, but also the people around me, and I think that's been a really huge gift to get from that process too.
Yeah, those are such amazing things to get out of it. I think we could all use more of that, being able to build up a tolerance for uncertainty, because like you say, everything ultimately is somewhat uncertain. And that compassion, like we can be our harshest critics. So if we can build those skills up, that's life-changing, isn't it?
Yeah, well, it's funny because when I started therapy and they introduced like self-compassion as a tool, because they give you like basically a sheet, it's like a worksheet, and they'd be like, you could do this, you could do this. Um, but self-compassion would have been bottom of my list when I started. I was like, "Pfft, like I'm not going to use that. Like that's a great tool for somebody else. But I can't tell you how many times today where I'm just like, I'm a really good person going through a really hard time right now. Or I'm doing the best with what I have or with the information I have. And even just like saying those simple phrases to myself brings so much like relief to my day and my brain.
Yeah, I think your experience is really common so many times, especially if you are type A and really good at getting things done. You're like,
Oh
okay,
yeah.
that I'm not going to do that one, but it can be the most impactful one.
Yeah, and it's funny because I still work with the same OCD therapist, and sometimes she'll poke fun at me and she'll be like, "Remember when you didn't like the self-compassion?" I'm like, "Yeah, I know."
So can you tell us about your advocacy work? Because I find this like so inspiring and you're helping to create so much change for children that have a congenital heart defect. So please tell us about this.
Yeah, I became a nurse practitioner and I literally had no idea, and I mean this, that heart defects are the most common birth defect. So they're 1 in 100. Now, not all of those people will go on to require surgery, but about a fourth of them will. But 1 in 100 is pretty significant. Like you're probably going to know someone who has a child with some sort of heart defect. Now, what was kind of mind-boggling and mind-breaking to me a bit was not only are heart defects the most common, they're also one of the very least funded. And there's a couple of reasons for that, but ultimately, this is really kind of a new area of medicine in a lot of ways. For example, if my daughter had been born even 40 years ago, then there wouldn't have been any surgeries for her. Like they literally would, like she would have passed in her first week of life. And so we're still figuring out this new area. And the other thing we're figuring out is it was actually just in 2009, there were more adults living with congenital heart disease than children. And what that statistic actually means, it was the first time that these children were living into adulthood. And on the other side, there's no like magical medication to fix congenital heart disease. There's all kinds of complex defects that require different surgeries and interventions. And so when you don't have those big pharma dollars, it's just a different conversation as well. I obviously have a lot of vested self-interest because every time that we reopen Meadow's chest to replace that valve, we open her up to a new host of complications and different things that can go wrong. And it is super complex to do the work that they do in there. She had her first heart surgery at 6 days old. And by the time she had her second at 4 months old, it took them 3 hours just to get through the scar tissue alone in her chest to be able to get to her heart. And so every time we're reopening that, I mean, it's just become more and more and more complicated, right? But what has been really cool over the last few years is they've started replacing these heart valves via heart cath instead. So they basically put a catheter in your groin and thread it up to your heart. They fix your valve, they take it out, you go home same day. Obviously, a very different experience than having your chest cut open, your heart manipulate all the different things, right? And I as soon as I found out like that was something they were doing and that could be possibly part of Meadow's future and that, these birth defects are so common, but they're not getting the funding that they needed. I just felt like I was the perfect person to become an advocate for congenital heart disease. I've got the medical expertise, I've got the personal story, and being able to bring both of those together to like go talk to legislators can be really monumental. And so I've actually done that a few times with a group where we literally go to Washington, D.C. and we'll have like a hill day and we'll talk about there's a particular piece of legislation that we helped get approved last year, well, reapproved, where they're trying to now do more research across the lifespan of like, okay, these kids are growing up, but what do they need and what kind of complications are they facing? But also expanding the workforce as well. Because right now, because it is still so new for them to be living into adulthood, which is a beautiful problem, there are actually not enough specialty trained cardiologists in congenital heart disease for adult patients. And so this bill that we work to get reauthorized is kind of tackling both problems. Like, how do we better monitor these people across the lifespan to figure out what they need? But also, how do we increase the workforce to meet their needs as well? Because they're going to have continued cardiac care the rest of their life. So I kind of got involved in a couple of different organizations. One does the Hill Day specifically, which I love. Another organization I work with does heart walks all over the country. And so I was the chair of our local heart walk this year, which was really fun. Um, and they raise money to do more research and more innovation just in the field of like different things that could come in the future, like Meadows, like Valve. And um, I would say outside of that, kind of more personal to me is I've started writing children's book about heart defects because there's not a lot of representation of congenital heart disease in children's books, but it is the most common birth defect. So next year in Heart Month, and Heart Month is in February, I will launch my first of what will hopefully be a series of children's books about congenital heart disease. So all the things and all the pieces.
Yeah, so your trend of doing a lot and being across a lot of different things is continuing, and that is incredible that you're doing that work. For somebody listening, like where do you recommend people start with advocacy? Like maybe it might be something else that they're really passionate about and they want to grow awareness of and advocate for change. But like where do people begin with that?
I think it's easiest to find a group. Like find someone that's already doing what you're interested in or what you're hoping to advocate for and see what they're doing. Because I mean, my first taste of advocacy was literally a Hill Day. Like somebody posted about it on Facebook. They're like, hey, Conquering CHD, they're going to Washington, D.C. in May. And so I just reached out. I was like, how do I go? Like, do you need somebody from Kentucky? What does this look like? And they were like, we would love to have you. And once you kind of get in one door and make a couple of connections here and there, then it just opens up so wide. I mean, I work pretty regularly with about 7 different organizations right now that all touch congenital heart disease in different ways. And I'll be so excited for there is a future, there's a vision, there's a dream coming together where all these little grassroots organizations are going to come together under one alliance. So I'm hoping to really kind of hope like pioneer and help steer that along. But I think even just joining one organization or reaching out to even one connection that you can make from someone who's already doing the work, like it really opens up everything else.
Yeah, that's really good advice. And probably that goes across anything that you want to do. Like find
Yeah.
people that are already doing it and join what they're doing. We don't necessarily need to reinvent the wheel, do we?
No, definitely do not.
And in terms of like your vision for where this advocacy work is going to go, like you mentioned something there that you want all these groups, these smaller groups to come together and you want to be a big part of that. What else do you see happening or what do you hope to happen with this work?
What I often tell people, and they kind of look at me like I'm crazy when I'm saying it, but I'm going to keep saying it until it happens one day, is I want to live in a world, and I don't care if it happens when I'm 94, but I do want to one day live in a world where children don't need open heart surgery to fix their defects. And we could do it all via alternative procedures. Um, and for other families to not have to experience all the things that we experience as a result of Meadow surgeries as well. So I think like that's my dream, even if it's a little audacious. But right now, my dream is getting all these organizations to come together because, is it really cool to do a Hill Day with 200 people? Yes. And is that still impactful? Yes. But if we brought all these organizations together and we had a Hill Day with 10,000 people, I think that's a totally different feel. And it would bring so much more legitimacy to the work that all these different people are trying to do because so many people care about this issue so much. So we've got to figure out a way to come together in a more cohesive fashion.
Mhm. I like that your goals are audacious because if they're not, like what's the point? Why
Yeah,
dream
it's not any
small?
fun.
Yeah, exactly. So, and I think that is doable. Like you're already seeing that potential happening, that there are these other really less invasive surgeries happening, that why can't that be the future?
Well, and I've seen it too with Meadow in other regards because as a complication from her second surgery, she ended up with a pacemaker. And when we went to her appointment this year, it was so wild. It was like so cool for my medical brain. Her pacemaker today is probably like, I don't know, like 3 inches times 4 inches. It sits in her belly off to the right side, and then the leads lead up to her heart. And when we went to her pacemaker doctor, he was like, well, if she continues to need one in the future, like when she has her next like valve replacement, he's like, we'll take this out and we'll put this new one in. And he literally like pulled it out of a drawer to show it to me, and it's the size of a quarter. And so it wouldn't be visible from outside of her body at all. Because right now, like if you raise up her shirt, like you can visibly see her pacemaker underneath her skin. Um, but even to just see that progression in the last 3 years, 'cause I mean, Meadow's 3.5 and her pacemaker's already obsolete that she had put in at 5 months old. Like that's crazy. That's so cool though.
Yeah, that's really exciting to see that the advances that are happening and how quickly they're happening.
Yeah.
Was there anything that you wanted to mention here that we didn't touch on that you think would be important for listeners to know?
I think we touched on a lot of things. Um, I'm trying to think. Yeah, I think the biggest thing that I would maybe just want to like touch again because I think it's so important is figuring out how do you sit with other people in their grief and their weirdness and their discomfort, all their things, because grief is such a universal experience. And how can we better society work to just let people sit in that? Sorry, there is a tornado siren going on. And it's a like a what's the word I'm looking for? It's like the routine where they just do it apparently at noon. But it's making my brain go.
Yeah,
My
fair
brain just
enough.
shut right off.
Yeah, that's what those do. They get you into fight or flight, right?
Uh-huh, uh-huh. I was like, oh,
So what do you recommend? Like, what could people listening do to start sitting in that discomfort and that grief of their own emotions or other people's? Because I think a lot of the work I do is in that space, and it is so hard. We're not trained as children or as adults to sit with grief or sit with hard emotions, and especially other people's. Like, we just try to stop them.
yeah. I mean, I think when it comes to like figuring out your own, like it doesn't have to be a solo process, because we're not equipped as a society and it's not something that is necessarily like ingrained in us by any means. My first really like sitting in grief and figuring out how to do that was with a therapist. And so if you feel like you're having really big feelings that you don't know what to do with, or if people around you are having really big feelings and you're like, how do I manage these? Because I mean, that was probably a piece that we didn't talk about, but obviously my husband has his own feelings and his own grief and his own sadness about everything that we experience that's kind of unique and different to mine. And people would think it's the same because we lived through the same thing and we very much experienced it differently. But, I work with a therapist, he works with a therapist to figure out, how do we navigate this together too?
Yeah, I think that's so helpful. And I love that you touch on we don't have to do it alone. Like, we don't have to
Yeah.
go through experiences by ourselves. And it's actually a lot more effective and more pleasant, even if we do that with somebody else.
Yeah, because other people have perspective.
Mhm.
It's so nice, like when you're in the depths of your feelings, to have someone who has a little bit of perspective that maybe you can't have in that moment or don't have access to.
Yeah. And to sit with somebody who can stay in that space with you and let you feel
Yeah,
those things is often hard to find.
for sure.
Well, thank you for coming on here. Can you let us know like where we can find out more about you, where we can buy your book? What is your book called? The first children's book.
It's called Meadow and her four-leaf clover heart because the odds of Meadow's heart defect are the same odds as finding a four-leaf clover. So we try to put a little bit of a positive spin on it for her, and she loves calling it her clover heart, which makes me so happy.
Mm.
Um, but I am everywhere. You can find me on Instagram, you can find me on LinkedIn. I have my own website, which is sarahmichellebose.com. And my book, when it's available, which will be very soon, will be available just on Amazon. I mean, you can get it anywhere you would normally buy a book.
Yeah. Okay, amazing. Thank you so much. And on socials, are you Sarah Michelle Bose on there as well?
Mhm.
Okay,
Yeah.
excellent. We'll put all that in the show notes. I just like to have people say it here just in case people don't look at show notes.
Yeah.
But yeah, thank you so much for coming on here and talking to us about this. I think it's really important in what you're doing. Like you're helping to change the world, and it's just so inspiring. So thank you
That's my
for,
goal.
yeah, you're doing it, right? You're already doing it. So thank you so, so much. Keep going.
Thank you so much.